Describe the knee joint under the following heads: type, articular surfaces, ligaments, bursa, relations, movements, and applied aspect. Knee joint is the largest and most complex joint in the body. It is formed by medial and lateral condyles of the femur, tibia, and patella. Okay. It is the major weight-bearing joint in the body, hence the most stressed joint in the body. It has three articulations: medial tibiofemoral, lateral tibiofemoral, fibula, and third patellofemoral joints, hence it is complex joint. Now, if the patella is here, patella, okay. Now, this has surfaces because it has to glide, you see like this. Like this. Now, actually due to any game you are playing, football or something, or running, you catch a running bus, you drop, you come out of you want to running bus, you just want to get out of the bus, or by catching a train, running train, suddenly it picks up, then you catch up. All these are the conditions where you are most prone to your game, that you will be prone to injury. And that the most this thing is that it can be meniscal injury, it can be the patellar injury, it can be tip of the malleolus. The tip of the malleolus, now this is the fibula, this is the medial malleolus of tibia. There can be tip over here, there can be a small fracture, but it's very painful. Even in this small fracture, painful, swollen. Okay, but you just examine clinically, oh, get it. Now, the the posterior aspect and the anterior aspect, these, when you study the leg, you look the compartments, it's in the compartment, and there are, when we show you or demonstrate to you, then you will see the muscles. What are the muscles? The anterior group of muscle, posterior group of muscle, the bare area, which is the bone is covered by periosteum. Okay. Now, the vascular is the continuation of the femoral artery. Now, when you study the femoral triangle, it's the base. Now, this I'll go knee joint classification, articular surfaces. See, the condyles of the femur, tibial condyles and patella. Patellar surface, tibial surface, intercondylar surface. Tibial condyles, lateral condyle, medial condyle, intercondylar area. Patella, posterior articular surface. You, after seeing the bone, one by one you will come over here and just see the patella also. एकदम देखना and classification type and modified hinge, synovial, condylar, complex, compound. Please study this from your general anatomy. General anatomy you study from any book, but at that time Mr. Datta, he came out with this. Samar Mitro, they came out of the book. So, Datta's a small separate book in general anatomy that you can go into it, because general anatomy definition, the different types of cells, cartilages and all is very nicely depicted. It's around 100 pages or something. It's a small book, but you don't have to hunt for it. If you are this thing comfortable with your book, please be comfortable. Don't be crowding your head with different types of books. Okay. Now, see, this is the femur, this is the medial condyles, patella, articular surface, anterior view femur, tibial articular surface, lateral condyle here, intercondylar area, medial condyle, superior view, and tibia patella here. Now, knee joint is supported by the following ligaments: capsular ligament and synovial membrane, ligamentum surface, tibial collateral ligament, fibular collateral ligament, oblique popliteal ligament, anterior and posterior cruciate ligament, arcuate popliteal ligament, medial and lateral menisci transverse ligament. This is the minimum framework. Now, you just have given you the bones, you split into groups, go to the skeleton. By the time those are not, you cannot access. You see, you have 11:34. 1 hour you are getting. Accordingly, you just see. Hey, boy, দেখে নেবো, manage হয়ে যাবে, don't. বসো, করো। ঠিক আছে? বল, start. কি বললাম? শরীর খারাপ? কারোর জন্য মন খারাপ? See this portion, this part, this ligaments of the knee joint you draw. I'm just showing you. I want to say that when you have a khata and draw and like this illustration, you see, you have the book and this thing. See, this is the common, the upper end of the tibia can be a short note. What are the draw and level the upper end of tibia with all ligaments and menisci and anterior cruciate ligament, posterior cruciate ligament. Even in viva, it is very strongly, because if any examiner, he will ask for the upper end attachment. But talofibular ligament or that talofibular joint, it won't be asked so much. But I'm trying to say, you have to focus for your examination and you have to study accordingly. And hate dekho, and feel it, touch it, everything. There are some polythene gloves. These 100 gloves, 50 rupees. The plastic, you use and throw. But don't throw anywhere. You put it in the bin. If you don't want to buy silicone gloves, rubber, silicone, now you buy these plastic gloves. ধরো আমি দেখছি এরকম করে, একটু মনে হলো টাচ করবো কি করবো না, আবার একজন এমনি করে ঝুঁকে চলে যাচ্ছে, দেখে যাচ্ছে, বডি কাটছে, করছে। ঠিক আছে? It is, you draw in your khata like this. This thing, the hip joints, capsule, what type of joint, and you will get your general anatomy, pehle padh lo. It will be a revision, MCQ, or your this thing. Please come and study amongst yourselves.